Hi there, and welcome to our career training series. I'm Ruby, and I'm one of the recruiters here at myCNAjobs. Today's training session is for caregivers and certified nursing assistants that are looking to learn best practices to transfer a patient from their bed to a wheelchair. During a transfer, the safety of both your patient and your own is critical. Let's dive into a few best practices. We'll go over how to prepare for a wheelchair transfer, how to sit a patient up, how to stand a patient up and how to sit a patient down, what to do once a patient is in their wheelchair. Number 1, how to prepare for a wheelchair transfer. In order to successfully move a patient from a bed to their wheelchair, you'll need a few tools. Number 1, a gait belt is optional, however, this will facilitate the lifting process. Number 2, a wheelchair. Number 3, if you're unable to perform the task by yourself, do not hesitate to ask for help. You want to communicate with your patient, introduce yourself, and explain how the process will work. Wash your hands, and if needed, wear gloves in case there are any body fluids. Number 2, how to sit a patient up. Ask the patient if they can scoot themselves toward you on the end of the bed. If they need help, go ahead and assist them. Have the patient cross their arms over their chest and put your arm underneath their shoulders and the other arm underneath their knees. Make sure your legs are in a wide stance. Count to 3 so you and the client are on the same page. Lift their back and pivot the patient's legs over the edge of the bed and have them sit up straight and ask if they feel dizzy. Number 3, how to stand a patient up and how to sit a patient down. Now the next step is crucial because you're lifting the patient up from the bed and onto the wheelchair. Have the patient scoot to the edge of the bed and once again assist them if needed. Help the patient put on their shoes. Ask the patient if their shoes are on properly and make sure their feet are flat on the floor. If you have a gait belt, put the gait belt around the waist. 4 fingers have to be placed between the gait belt and the patient and lock it into place. Position the wheelchair next to the bed and lock it in. If you do not have a gait belt, grasp your hands behind the patient's back for support. Have the patient put their feet together and explain to them how you will lift them up so the patient, not yourself, will get hurt. Have them put their hands over your shoulders and grab them by the gait belt with one hand on each side of their waist holding onto the belt. Count to 3, lift, and bend your knees as you pivot onto the chair. Number 4, what to do once a patient is in their wheelchair. Once your patient is in their wheelchair, ask them if they are comfortable. Position the leg rests and foot pedals for support and carefully lift their feet onto the pedals. Ask them one last time if they are comfortable and if they need anything before you leave. Ensure nothing is in their way. Thank the patient, dispose of the gloves if any were used, and wash your hands. Well, that's it. If you like what you saw here today, there are some more training videos and free resources available at myCNAjobs.com.